Hi class, and welcome to week 5 of Kin 264. I'll be finishing up the grading for the midterm soon, and just like the last quiz where there's a lot of fill-ins, I'll be going over those and making sure that any answers that were answered correctly are that you're giving credit for, because I know some the settings that the quizzes have or the midterms have sometimes don't account for some of the arrangement of words, the way that you write things. So don't worry about that. Just sit tight while I go over them and give you guys credit for all that stuff. This week, you guys have a CAT 4, a hip muscle chart, and the fourth quiz, which are all due on Sunday. And this week, we're going to turn to the hip joint and the pelvic girdle. So the first few things that you should know are the bones, which in this case are some of the biggest bones in the body because they support a lot of weight. There's the femur. I'm sorry. Let's start off with the pelvic bones, which are made up of the ilium, the ischium, and the pubis. And just so you don't get confused, the pelvic bones or pelvis is referred to as the whole portion here. And there's a right and a left pelvic bone. But technically, each pelvic bone is made up of three different bones: the ilium, the ischium, and the pubis. And the difference is that they're fused. So that's I guess, the only stipulation when discussing the pelvic bones. So the ischium makes the posterior portion of the pelvic bone, and then you also have the pubis, which makes the anterior portion, and then the ilium makes the superior portion of the pelvic bone. And all three of these bones meet here at the acetabulum. So when you're looking at that junction between the head of the femur and the pelvic bone here at the acetabulum, we're looking at actually three different bones. So moving on to the femur, we also have the sacrum and the coccyx, and you can see them here. This is the coxofemoral joint, where the head of the femur joins the acetabulum. We have your sacrum and the coccyx. And for the sacrum, it's sort of an extension of the spinal column. So right here at the base of the sacrum, you would have the lumbar vertebrae joining there. And it's sort of an extension of that. It's technically 5 fused vertebrae that make up the sacrum. And extending even further than that is the coccyx, which is the technical term for your tailbone. As for the joints, anteriorly you have, like I mentioned, the hip joint, or technically called coxofemoral joint. You also have the symphysis pubis. And then posteriorly you have your sacroiliac joints. You have two of them. This is where the ilium portion of the pelvis joins the sacrum, and you have two of them. Ligaments of the hip and the pelvic girdle are some of the strongest in the body, especially at the hip, where you have the iliofemoral ligament, also known as the Y ligament or ligament of Bigelow, which you can see here, the pubofemoral ligament, and ligament of the head of the femur. This last ligament, the ligament of the head of the femur, is also known as a ligamentum teres. And all these provide support for the head of the femur on the acetabulum, making sure that there's no translation or excessive translation during any hip movement. The movements of this section of the body can be separated into the hip and then also the pelvic girdle, as we've been doing so far. The hip can flex, extend, abduct, adduct, externally rotate, internally rotate, and then there's also a combination of some of these movements where you can end up with diagonal abduction and diagonal adduction. As for the pelvic girdle, there's 6 different movements. If you look at your in your textbook, table 8.2, there's a breakdown of the movements that occur in the lumbar spine and both hips for their to be these pelvic girdle movements as anterior pelvic rotation, posterior pelvic rotation, and then there's also lateral pelvic rotation for the left and the right side. And for each of these to occur, there has to be some sort of movement at the lumbar spine and at the hip. Moving along to the muscles, on the anterior side of the body, we have the iliacus and psoas major and minor muscles, which can sometimes be referred to as like one muscle, the iliopsoas. But in a lot of anatomy books, they actually they separate those two. But they both do the similar motions. They both help in hip flexion and external rotation, and they're very deep muscles. So, like in this image, they don't show them because they're under the abdominals. But in other images, you'll see that they're very deep to the abdominals, so they attach mainly to the pelvis, and some part of those fibers also insert at the spine. Next, you also have the rectus femoris and sartorius, which again mainly help with hip flexion. But these muscles are biarticular, meaning that they cross two joints. So rec fem and the sartorius, they cross the hip joint, but they also cross the knee joint. The difference between these two is that the rec fem does hip flexion, and at the knee it extends it. The sartorius does hip flexion, but at the knee it flexes the knee. And the difference is that the sartorius inserts medially to the knee, the rec fem right over the patella into the patellar tendon. So that slight difference in attachment makes one, the rec fem, an extensor, and the other a knee flexor. On the medial side, you have the hip adductors, including the pectineus, adductor brevis, adductor longus, adductor magnus, and the gracilis. And so anytime you're palpating on that side of the hip, you're mainly going to be dealing with adductors of the hip. Posteriorly, you're going to have the muscles that do hip extension, or in some cases also knee flexion. So for example, you have your three hamstrings and the glute maximus. The three hamstrings are the semimembranosus, semitendinosus, and the biceps femoris, and those are listed medially to laterally. However, the semitendinosus kind of covers up a little bit of the semimembranosus, so it's kind of right on top of it. And finally, the most lateral muscles of the hip are the gluteus medius, gluteus minimus, and the tensor fasciae latae, also known as TFL for short. And these muscles mainly perform hip abduction and internal rotation. And you can see these a little bit out here with the gluteus medius and tensor, the TFL. You can see it on this side out here. Now, as far as the external rotators of the hip, the main external rotators can be found very deep within the hip, and most of them originate on a portion of the pelvis, and all of them mainly insert on the greater trochanter of the femur. There's 6 of them: the piriformis, the gemellus superior, gemellus inferior, obturator internus, obturator externus, and the quadratus femoris. Innervation of the lower extremities occurs through the lumbosacral plexus, just like in the shoulder where you have the brachial plexus starting from roots. The lumbar portion of this plexus is made of L1 to L4 and some fibers of T12. The sacral plexus is formed by L4, L5, and S1 through S4. The 2 most important nerves that arise from the lumbar plexus are the femoral and obturator nerves. The important nerves to know from the sacral plexus are the superior gluteal, inferior gluteal, and sciatic nerves. Now, this last slide here looks really busy, but it does give you an idea of where certain neurological symptoms could arise from. If you're having a patient having trouble with certain movements, and you can note some muscle weakness, and when you compare bilaterally, um, you can kind of deduce what levels those issues are arising from. In athletics, you're going to deal with some low back injuries. It's not uncommon to see that. And at times, you can start following that pain pattern, um, back to a specific nerve root. And there are times where you have weaknesses in the hip, glute medius or hip flexors, and there's really no mechanism of injury for it. That's usually a good time to start looking for neurological symptoms and maybe tracing back where the weakness is coming from. Maybe there's a slight strain or a disruption at one of these nerve roots. That's all I have for you this week. I wish you guys the best this week. Please make sure you're keeping up with your studying of um, the hip, pelvic girdle anatomy. Any questions with any of this, please reach out to me. This should be a little bit lighter of a week as compared to the last few weeks. But again, if you have questions about this week or any other week, reach out to me and I'll get back to you as soon as I can. Thank you guys, and I will see you later.